Do you struggle with constipation regularly or feel like you don't completely empty your bowels? Constipation is one of the most common digestive complaints, but the cause is often not what people expect. In this video, I'll explain the 5 most common causes of constipation and when you should see a doctor. Hi, I'm Dr. Andy Thanjan, a gastroenterologist, and I help patients understand their gut health and their digestive symptoms. Constipation doesn't mean just going infrequently. It could also be having hard or pellet-like stools, straining to have bowel movements, or feeling like you didn't fully empty. So what are the causes of constipation? One cause could be a low-fiber diet. Most Western diets are fiber deficient. Fiber helps to add bulk to the stool and easier to pass a bowel movement. Western diets tend to be heavy on processed foods and low in fruits and vegetables. A second cause is dehydration, because once the body is dehydrated, the colon absorbs more water from the stool. This could lead to hard bowel movements or incomplete bowel evacuations. A third cause is a sedentary lifestyle, because movement helps the bowels to move. People that spend most of the day sitting often notice that they have worsening constipation. A fourth cause are medications. Some classic medications that can worsen constipation are opioid medications for pain, calcium supplements, iron supplements, and even some antidepressant medications. A fifth cause is a slow colon or an overlap with irritable bowel syndrome with constipation. Some people naturally have slower gut motility, which could be a cause for them to have more constipation issues. And another possibility is irritable bowel syndrome with constipation predominance. If you want to see and learn more about irritable bowel syndrome with constipation, please watch my last video about that. So when is constipation concerning? These are the red flag signs you should look for when you're evaluating your bowel movements. If you notice bloody stools, unexpected weight loss, low iron anemia, or new constipation over the age of 50, you should see a doctor for further evaluation. So what are some easy things you can do to try to improve your constipation issues? First, you should try to increase fiber gradually. Whenever you're increasing fiber in your diet, you should not do it too abruptly to high levels, because that could lead to worsening gas, abdominal bloating, and sometimes abdominal pain. So gradually over weeks, you should increase your fiber to try to aim for 25 to 30 grams of fiber a day. So what are some examples of foods that are high in fiber? So one are legumes, things such as black beans and lentils. Another is vegetables such as broccoli and carrots. Also consider fruits such as raspberries and pears. Also eat plenty of whole grains, nuts, and seeds. These things could definitely help with your bowel habits. Another thing to consider is hydration, because we know that water helps fiber to work effectively. So make sure that you are drinking water throughout the course of the day, and that will help to lubricate the stool and make it easier to pass. Another thing to try is physical activity. Walking helps the bowels to move. So even if you sit most of the day at your job, try as much as possible when you have breaks to get up and walk around, especially if you're dealing with constipation issues. Constipation is extremely common, but once a cause is understood, then it's easily to be managed. If you found this helpful, consider subscribing to see more videos about digestive health. Take care.